So welcome to our webinar series. My name is Carla Cochran, and I work in the data sovereignty area within the First Nations Health and Social Secretariat in Manitoba in the research department. And we have started a webinar series since April of this year, which will lead up to our event that we're hosting in January 2025. We have held a series of webinars, so some of you might have joined in, and we thank you for that. We had Data 101. We talked about data sovereignty in Manitoba region. We shared about OCAP and ethical principles, how to set up your own research information governance committee. So we shared a bit. Today, I'd like to welcome Leona Star, the Director of Research from FNHSSM, who will be sharing with us about telling your story through data. If you have any questions, there is a Q&A box at the bottom, and we'll ask throughout, and we can ask at the end. But also, if you have any questions, you could also use the comment box too, because we'll be monitoring that. And for those that have joined us, welcome. If you could please share where you're calling in from or where you're joining us from, your name and your territory or your organization. But with that, we'll turn it over to Leona. So welcome, Leona.
Thank you for that, Carla. Dances, Katalpiasus, Goinasigosin, Mangindodam. Good afternoon, everybody. My name is Leona Star. I currently work as the Director of Research within the First Nations Health and Social Secretariat of Manitoba. Originally, I come from Thornridge Health First Nation in Treaty 6 territory, where I'm calling in from, actually. So today I'm going to share with you how Manitoba First Nations have really demonstrated telling their own stories through data. Just checking. So before I get into it, just depending on where you're calling in from, I thought it was important to really provide you with a map of who we work for as the First Nations Health and Social Secretariat of Manitoba. Within Manitoba, there are 63 First Nations who are located within Manitoba, and we work with each and every one of them. As of August 2024, there's about 177,000 registered Manitoba First Nations. 54% of First Nations currently live on reserve in Manitoba. We're from Manitoba. That's not the same story across Canada, where people have relocated to urban centers to access services more directly, rather than because access is limited to certain services in communities. So a lot of people have relocated to urban settings to access certain supports and programs. Within Manitoba, we also work for 5 distinct nations. Although we identify as First Nations, we also have distinct linguistic or nations that we come from. So within Manitoba, they have the Anishinaabe, the Anishinaabe, which is located in the Island Lake region, the Innu, which is the Cree, and the Dakota and Dene. And it's important to identify each of these distinct nations, because each and every one of them have certain cultural protocols and practices that are very distinct too, that may not necessarily be the same across each of those nations. So it's important to build those relationships right from the very beginning. A bit of background in terms of the organization that was established in 2014 through Chiefs and Assembly, a mandate that was given to our organization in 2014. Previously, our health and social unit used to be a part of the Assembly of Manitoba Chiefs, which is the Assembly of Manitoba Chiefs was founded in 1989 as a successor to the Manitoba Indian Brotherhood. And their mandate was to protect and strengthen treaty inherent rights and to improve the socioeconomic conditions of First Nations people and communities living in Manitoba. When I showed you that map earlier, the Assembly of Manitoba Chiefs work and represent the leadership and communities of those 63 First Nations. So similar to other entities that have been established through direct mandates by the chiefs in assembly, like the Manitoba First Nations Education Resource Center, our organization was also established through a mandate provided by those chiefs in assembly. So similar to the Assembly of Manitoba Chiefs, our organization also serves those 63 First Nations. I'd just like to pause a bit and kind of take a step back in terms of recalling how many reports there have been in the past to really provide those calls to action, to provide those recommendations that really identify and demonstrate the inequities between First Nations and all other Canadians, because we know the health outcomes between First Nations and all other Canadians are not the same. And they're not the same because of many different factors, including the establishment of the Indian residential schools, including the establishment of, I guess, the stolen generations of our children that still continue to this day, even from the 60s scoop right up to the present day child welfare system that currently exists today within all territories all across Canada. Our children are still being taken. And throughout these like colonial interruptions, we've tried to demonstrate how these interruptions have negatively affected the well-being of and outcomes of our children and families. And time again, they pointed to those inequities. First report being the RCAP, the Royal Commission on Aboriginal Peoples, going back to the 1990s, 1996, followed by the Aboriginal Justice Inquiry in 1999. And then the Truth and Reconciliation Commission of Canada, which really shone the light on the atrocities that our people endured through the establishment of those Indian residential schools. And still today, we're unearthing the children who attended those schools, and there's still a lot more work that needs to be done to work through that process in a good way because they are children. And most recently, the report on the inquiry to missing murdered Indigenous women and girls. All of these reports point to the inequities and the colonial interruptions that created these inequities. According to the TRC call to action number 19, it really called for regular annual reports on various measurements or various indicators, including identifying what our infant mortality rates are as Indigenous people, maternal child health, suicide, mental health, the list goes on. In terms of being able to step a bit further into our nation-based indicators of well-being, it's good to have these measurements, but right now, those measurements are really measured from a Western understanding of what wellness is. In terms of being able to identify what our cultural connection and what those protective factors that exist and have always existed since time immemorial that have really helped the trajectories of our children and our families to live a good life. Call to action number 19 really demonstrates, really supports the linkage of existing data sets. What the story that we're going to tell today kind of identifies possible other data sets or the creation of new data sets to measure that wellness according to our own understanding and worldview as nations, as First Nations, as original inhabitants to these lands and territories. So how do we tell our own stories through data? one of the ways that Manitoba First Nations had really supported that assertion is that they developed their own First Nations Research Ethics Board called the Health Information Research Governance Committee that really supports that governance over data and research at a regional level. But also we're working directly with communities and tribal or nations to actually develop their own REBs within their communities or within their nations, to really define and determine what research is really needed to support their key priority areas. So we're working through that. We're working towards developing our own First Nations research data center in order to really demonstrate what the data gaps are, what the data needs are, and really being able to really tell our own stories, tell our own truths, and validate data, validate our stories, and to be able to be the leads in telling that story according to our own understanding and without the colonial interruption or interpretation of who researchers think we are. We've begun to develop our own surveys based on the strengths and cultures of our people, including, I'll talk a bit about the regional health survey, the regional social survey, and some of the other surveys that we've developed and supported in partnership with national and regional partners all across Canada, including the First Nations Information Governance Center. We've also worked towards developing our own regional and supporting nation-based indicators of well-being that really speak to that cultural understanding and that distinct nation-based understanding of who we are as original peoples and inhabitants to these lands and territories, and what makes us well and not what makes us unwell. We're really working to measure how to live a good life, essentially, rather than how close we are to death, which a lot of existing data sets really perpetuate. You don't actually, you are not actually seen within a data set unless you're in a crisis, or unless you show up at the emerge, or you show up in an institution seeking medical help or medical services or supports. We're also working to repatriate existing data sets and to determine whether or not certain data sets even warrant the repatriation, or determining how true those data sets actually are. Because one of the biggest challenges around utilizing existing data sets as they sit, as they're captured, if we're not a part of that data collection process, we leave it up to external people who don't necessarily know or are connected or have that understanding of our communities. So we leave it to somebody else who maybe has never stepped foot in our communities to capture data in a way that doesn't necessarily make sense to who we are, or doesn't necessarily reflect our truths, or doesn't capture the challenges or barriers that we face on a daily basis, including racism, discrimination, as we interact with certain systems. We're also working to create our own surveillance initiatives in terms of being able to capture our own people within existing data sets, but capturing them in a way where they're able to self-identify in terms of who they are and how they recognize themselves, not necessarily predetermined by colonial definition of who they are as status First Nations, but creating that space, that safe space for them to identify and connect with their own identity as they see fit. A bit of background in terms of our First Nations governance within information governance within the Manitoba region. It was back in the 1990s that this committee was initially established. It was established as an oversight committee to the First Nations Regional Health Survey. That was a national pilot survey. It started off as a pilot survey. Now it's like one of the foundational First Nations led and developed surveys across Canada that's supported by, they're now called the First Nations Information Governance Center, but it's comprised of a board of directors from 10 of the regions across Canada, and each and every region helps to develop and support and implement and carry out the data collection process according to their own nation-based needs. So this committee originally began in 1990s, 1996. It was mandated again through Chiefs and Assembly. Their mandate was further updated in 1998, and really their original mandate went back to overseeing the regional health survey, identifying reviewing existing research proposals to ensure that they aligned with First Nations ethical practices, and to ensure that First Nations had ownership control of their own information and data. I'm not going to go through each and every one of the mandates. I know this presentation will be available later online, but essentially, not only does this committee, is this a Chiefs mandated committee from all 63 First Nations, it's also been endorsed and supported through Chiefs and Assembly. So this committee provides that oversight not only to ethical practices to ensure research benefits First Nations, but they also ensure that First Nations data is protected so that First Nations actually have a say in terms of how their information is utilized, how their story is told, because it's no longer acceptable for researchers or provincial entities to really tell our story without us. Back in 2010, when we were a part of the Assembly of Manitoba Chiefs, we created our own First Nations data center. It was quite monumental. I remember repatriating some of our first RHS data, the Regional Health Survey data, because we undertook that in partnership with the University of Manitoba at the time. Because at the time, during the first iteration of the Regional Health Survey, we didn't necessarily have the infrastructure to hold and host our own data in a safe and secure way. We didn't have the resources. So then in the 2000s, we finally secured enough resources to create our own, I guess, a mini data center directly within our organization. That was the very first time that we were able to repatriate to house and hold and possess our own First Nations data. During that time, previous to that, it was the University of Manitoba that we partnered with. They carried out the survey because in partnership with us again. But since the 2000s, we know not only do we house and hold our own data, we actually provide training directly to community members to go out and collect their own information when it comes to the Regional Health Survey or any other First Nations led survey. So similar to a StatsCan data center, or similar to the Manitoba Center for Health Policy setups, what we're able to do, we've modeled our data center after the StatsCan data center. So not only do we have our own regionally led First Nations data within that server, we also have created space so that individual First Nations or individual tribal councils or other partners can actually house and hold your data on this server as well. Because oftentimes when you enter into a research project, by default, your information is automatically housed and held by that institution. We also want to create space for communities to actually provide that stewardship and governance over their own information and not have to continue to build or invest in institutional data sets that they may never be able to repatriate or to directly analyze themselves. I know research has come a long way, but there's still a long ways to go in terms of being able to support First Nation self-determination as it relates to their own information and data. There should be a line within every grant that invests back into a community to help build their own research server or their own data center. So a bit about the Regional Health Survey. As I said previously, it is a First Nations led and designed and implemented, is the only First Nations designed and led survey that has been established by First Nations all across Canada and under the direction partnerships of 10 regions across Canada and supported nationally by the First Nations Information Governance Centre. And it was created back in the 1990s in response to the First Nations being excluded from 3 major surveys that went across Canada. Yet when those surveys came out, or the results of those surveys came out, the government at the time tried to say something about First Nations. First Nations at the time, majority of them still lived in their communities. So then First Nations leaders got up to question the validity of those results because they asked the question, well, how can you identify that as our stats when you did not even collect, you did not go and collect on reserve? So there's a real distinction between on and off reserve First Nations in terms of being able to access direct programs and services that may not be available to them because they live on reserve. There's certain jurisdictional challenges that First Nations face on a daily basis, and they have to navigate that. One of the really unique things about the Regional Health Survey is that it was the only survey at the time to really ask about residential school attendance in a safe way that has been identified and supported by First Nations. It was the first time that we're able to measure the impacts of the residential school experience on their health outcomes. And we're currently in the 4th round of the RHS. Right now it's being deployed all across Canada. Another national survey that we're part of is the Regional Social Survey. This one focuses on the well-being of children and families living on reserve in northern communities. Right now, we're currently within our region creating that, working with the advisory committee to go through those survey questions to ensure that we're asking the questions that are culturally relevant, that are strength-based, and that measure ultimately measuring the well-being and the trajectory of our children and families. Oops. Okay. I think I just have an automatic transition there. So the previous slide I was trying to show it's really talking about some of the work that we did with our nation-based indicators of well-being. We did some work around some regional work where we brought together all 5 distinct nations to identify what their indicators of well-being were according to their own understanding and worldviews. They identified 8 key priorities, and we created a regional component to the regional early childhood education and employment survey to actually begin to capture some data around that to see whether or not we could actually measure those indicators. We also worked with Mississauga Cree Nation and the Blackfoot Confederacy in Alberta. We worked towards identifying what do nation-based indicators actually look like. We did the regional. Now we want to look at an individual nation, which we worked with Mississauga. They identified some key areas that they wanted to measure according to their own understanding. We also worked with the Blackfoot Confederacy at the time, where they worked with their 4 nations to identify what their indicators of well-being look like. One common question that we always need to ask ourselves when we're engaging in research, when we're creating a survey, is whether or not we have the correct indicators, whether or not we're measuring the right things. Are we measuring how close we are to being Canadians, how close we are to being how close we fit within the Western world, or are we going back to those original teachings that really goes back to fulfilling our purpose in this realm, in this time? Are we living the life that we were intended for as original peoples within our territories, the life that our ancestors had prayed for and continue to pray for? What are we actually measuring, and whether or not those measurements actually reflect our true purpose for being here? And if we're not measuring that, what are we actually measuring? And if maybe we need to change those measurements, and that's why that indicator development work is so important. That's why we really want to create space for the nations themselves to really do that work and lead that work in a good way. It's only them that can actually determine what their own indicators of well-being actually look like. When we look at repatriation, repatriation is, you have to find a good balance to repatriate information. And data repatriation goes hand in hand with data sovereignty. But unless you have the proper resources and investments to actually repatriate data, it becomes challenging. Because if you don't have the infrastructure to support the protection of the privacy and confidentiality of that data, then you really leave it, you're placing information at risk of data breaches. You're placing it at risk of being misused and mishandled. So when we talk about data repatriation, it's important to ensure that you have the proper infrastructure to house, hold, and protect that data. That data and those stories. Because one thing that within our team, we talk about, it's not just data. Within each and every single one of those data sets, it's our families, it's our children, it's our kukums and mushums that we see within those data, that information. It's their stories, and we have the responsibility to care for those stories in the best possible way so that our truths continue to be protected and told according to who we are and who we know we are. So it's also important to ensure that First Nations are engaged all throughout the process. And if they're not engaged throughout the process, you may need to consider taking a pause on that data collection to really bring First Nations on board to really have a look at what you're actually collecting, for what purpose and for whose use. And if it does not make it back into the hands of First Nations, you really need to reconsider why you're collecting information and why it's not going back to First Nations. And First Nations have to be able to tell their own story, regardless if the information is being collected by a non-First Nations entity. Sorry.
I do have a question.
Yeah.
If one wants to measure reconciliation, does it make sense to measure the progress on the 94 action? And if so, what things should be kept in mind while using the calls to action as a way to measure reconciliation?
That's a big question in terms of being able to measure reconciliation. I think it depends on how you're actually defining reconciliation, because reconciliation actually looks different in many different areas, depending on who you're working with or which population you're working with. Again, it's important to go back to those foundational pieces of ensuring engagement all throughout that process. Because if you do not have the involvement of First Nations all throughout that process, your measurements are going to be questionable. You'll be measuring reconciliation from a non-First Nations understanding of what reconciliation actually means. Yeah, it's not a direct answer, but it's like measuring reconciliation is a big question. Really depends on who you're working with and what the purposes of measuring that reconciliation is. But it's also important to have some action attached to that reconciliation. So what if they're failing at reconciliation? It's not enough just to measure. You have to be able to act on those measurements to actually correct those inequities, correct those injustices if they are or continue to occur. Any other question?
No, not yet. That's
okay. Okay. So really it's about ensuring data repatriation goes hand in hand with ensuring that you have the actual infrastructure to be able to repatriate that data. And it's not always about repatriating any and all First Nations data. It's also about evaluating the validity of that information, because the outcomes that you're going to get, depending on how information is collected, if you don't have good data that you're collecting, your measurements and your outcomes are not going to be, they're going to be questionable because they're not going to be valid, depending on the way information is captured, who's capturing it, and how it's being captured. And if you don't have good data coming in, your data coming out is going to be incorrect. So it's really about evaluating existing data sets and whether or not it's worth repatriating, or how do you actually correct it so that it is good data.
I do have another question that asks, what does data structure look like and what's needed?
I don't understand. What do you mean? Like First Nations data structure, or building a First Nations data center?
Hold on one second. We'll get the person to type it in the box, but we'll get back to it though.
I'm not going to go into great detail on this slide. This kind of demonstrates how we've come to link existing data sets with First Nations identity to create what we call a key linked file in order to pull out Manitoba First Nations from all other Manitobans. because right now, previous to the data linkages, First Nations used to be lumped in with all Manitobans. Yet so it was really hard to advocate with when our numbers were mixed in with all other Manitobans. What we were able to do now, because we started linking the First Nations Indian Status Registry with the Manitoba Health, our Manitoba Health numbers, we're now able to pull out Manitoba First Nations out from the overall Manitoba population. So we're able to measure our own outcomes, measure our own access, or what those barriers are to accessing services and programs, and really utilizing that data for further advocacy and really arming our leadership with the data that they need when they go and negotiate on behalf of their communities, in terms of these are our rates, and these are our rates in comparison to all other Manitobans. If you look at any type of stat within Manitoba, you can almost always see our rates as First Nations are much higher than all other Manitobans. And I'll talk a bit about some of the initiatives where we were able to demonstrate how our outcomes were higher than all other Manitobans, and how leadership was able to utilize that information. So again, going through that governance piece, we didn't start linking data without the support of the 63 chiefs in assembly. We had resolutions that were passed during assemblies that approved these data linkages between the Manitoba Indian Status Registry and all other data sets, which allowed us to we published a few reports in partnership with the province. We called them atlases. One of them was in relation to our First Nations children, looking at the health and well-being of First Nations children in Manitoba. We also did one on the health atlas, the health status and access to healthcare by First Nations living in Manitoba. It really talked about those health outcomes of both adults and our children and families. What we were also able to do, we're also able to deliver community-based health profiles back to each and every First Nations within Manitoba by, again, linking through those data linkages. And those reports can be found online at those links down below. One of the most recent data linkages that occurred and that really supported Manitoba First Nations in their response to the COVID-19 pandemic was being able to identify First Nations COVID cases, testing, and vaccination uptake. A bit of, just want to highlight how we've come together as organizations and entities to form under the direction, again, around the direction by chiefs during the time back in 2020 when the pandemic first hit Manitoba, when things started shutting down. Our chiefs quickly acted to direct our organizations to come together to form what we called the Manitoba First Nations Pandemic Response and Coordination Team. We came together as a team. We didn't come together in silos. We didn't come together as organizations. We brought together all of our key leads to work collaboratively to support the pandemic response as a region, but as well as we did what we could to support that nation-based response directly in community. So my role within that pandemic response and coordination team was to start looking at information and data. So we brought together our health information research governance committee. We quickly formed a First Nations COVID-19 data working group, which included members of our HERC committee, members of FNHSSM, members of the Manitoba Health Unit, the Epi and Surveillance Unit, FNIB, and Angamazon at the University of Manitoba.
I do have just one question. Sorry, Leona. I do have two quick questions.
Okay.
It goes back to what you're talking about with the Manitoba Center for Health Repository. Someone just asked, can you link to data in the Manitoba Center for Health Repository? And then I have a second question for you.
Yes, you can link to the Manitoba Center. So the Manitoba Center for Health Policy, for those of you who don't know, is probably one of the most internationally renowned data repositories, because they bring together justice data, education data, health data, social services, any type of provincial data set that's collected within Manitoba. It sits at the Manitoba Center for Health Policy, and it's governed by information sharing agreements with each and every provincial entity that collects that information. We also have an information sharing agreement between FNHSSM and that center, and that allows linkages between First Nation status and all those other data sets. But it's the Health Information Research Governance Committee that provides the review and approval of those data linkages. So any type of data linkage, if it has to do with First Nations, that proposal goes to the Health Information Research Governance Committee, and they review that proposal based on their research protocols, their research requirements. And then it's only then that you're able to pull out First Nations within those other data sets.
The next question I had was just wondering how the data is stored in a shared portal environment, and wondering what is your information request process?
Our information request process is filling out a HERC application, because they ultimately provide that oversight and approval to any type of access to First Nations data. If it goes through it has to do with any other First Nations data sets. Again, it goes through HERC, because they're that regional oversight body to any First Nations data. In terms of access, depending on what type of data you're requesting access to, sometimes that access goes to the Manitoba Center for Health Policy. Sometimes that direct access comes, you're able to access it on site at the FNHSSM offices. So it depends on the data, which data set you're requesting access to. But one of the key things, it's not just about requesting access because you're just curious. You need to have a First Nations partner. HERC will not look at any type of research that does not have a First Nations partner. Because as First Nations, we're done being investigated, we're done being researched based out of curiosity. It's not enough anymore, and it's not ethical. Any other questions?
Going back to the question about the data structure, what's needed, they just clarified what's required for a full wraparound approach. So I think it talks to more of the actual physical structure.
Refresh my memory on what the original question was.
The question was, what does data structure look like? So I think it's the structure when I think it's like the physical. When does it, like when we collect data, what's the structure? What's a good one to have for wraparound approach? We could put that on hold. Candace, we could link with you just to connect for that question.
So I think like that response like really depends on the First Nations themselves in terms of what that data infrastructure or those requirements actually look like in terms of what our requirements look like as a region. We're already building that, but we're also building it in response to communities' needs. And that's the work of the data sovereignty team in terms of creating our own research data center. So it's not a one size fits all. You really have to work directly with your partners to actually identify what those needs and requirements are.
Thank you, Leona.
So one of the things that we were able to do during the COVID-19 pandemic was to really capture, we negotiated probably the fastest ISA probably in history with the province. We were able to negotiate a information sharing agreement within 1 month, and we had it signed by all the partners. And that was because we had that infrastructure in place. We had the Health Information Research Governance Committee in place, which is, again, that chief's mandated committee to provide that oversight and governance to First Nations data. So what they were able to provide, HERC provided that approval to capture First Nations identity throughout the pandemic, utilizing the following 3 data sets. We included capturing First Nations identity on the intake form of COVID-19 in terms of how people present to the healthcare system. First Nations could voluntarily self-declare as First Nation status, non-status, Inuit, or Métis. They were able to, we also linked to familial relations, whether or not a COVID-19 case had a sibling or a child that was First Nations. We also pulled those in. We also looked at, again, linking to that linked file where it identifies all First Nations status people within Manitoba. And again, this was all governed by our Health Information Research Governance Committee. Some of the outcomes of those data linkages, and I guess like one of the highlights, I'm almost out of time. I'm going to quickly go through this. The biggest thing was being able to support communities in their own pandemic response initiatives being led by the nations themselves. They're able to identify how their communities were, whether or not their communities were going to go into lockdown, whether or not their communities were going to slowly open up. It really supported the closure of the Northern Territory very early on during the pandemic. We're able to help support in rapid response teams in community to support the testing, contact tracing, and support that surge capacity as needed within communities. We're able to provide community-specific reporting to partners at the province, as well as we're supported by the province's EPI people, as well as people within the Public Health Agency of Canada, where communities, they actually went into communities to provide that EPI support. We're able to, because we had access, we're able to demonstrate how First Nations in Manitoba made up a higher proportion of hospitalizations and fatalities during the pandemic. We're able to access the vaccination as a priority group. Had we not had access to this information, First Nations may or may not have had a direct access as quickly as we had during the pandemic. Oh, That's my last slide. And that's it. Any other questions?
We'll open it up if you have any questions. Put it in the chat, the Q&A. I see that there is a hand up. If you can type it out, that would be great, either in the Q&A or the chat box. I did share about the presentation recording, or if you have any questions for the data sovereignty team, I do have a one-pager that I have that connects to this presentation, just to ask you questions that were posed about setting up your own or telling your own stories. And then in addition, we also do have our list of upcoming webinars. So I'll open it up for questions and answers if anyone has a question. Our upcoming webinar and for October is Proposal Writing 101. So that will be going through the base of proposal writing and how you can do that. We'll have just the standard proposal writing, but as well as academic. For November session, we will have a community and as well as an institution-based led archive group come join us to talk about Archives 101 and some considerations to take into place. And then we'll have our conference January 21st to 23rd, 2025, RBC Convention Center. It's the First Nations Data Sovereignty and Research Governance Conference. The theme is Our Data, Our Truths, Our Voice. So it will be held here in Treaty 1 territory, and registration should be open soon. So if I see no questions, we thank you so much for connecting with us today, and we look forward to connecting with you in our future webinars. And thank you so much, Leona, for sharing your knowledge with us today. Appreciate it. And then our email is fnhssmdatasovereignty@fnhsm.com. It is in the chat box and it is online here. But if you have any questions at all about, I seen there was one question about a template for data sharing agreements. We are creating a template, our team, and we will share it with you just as a base, some ideas to get into it. And at the same time, Candace, if you want to reach out again, we'll connect regarding your question a little bit further deeper. All right. Thank you so much for joining us. Have a great day, everyone, and take care. And we'll see you again next month. Thank you, Leona.
Thanks, Carla. See you.
See ya.